Usually when you get a medical implant or, some kind of physical augmentation, you expect it to be this permanent static fixture.
Right, like an engineering problem.
Exactly.
Yeah.
Get a titanium pin put into a broken ankle, and that pin it just stays there.
Yeah, it remains the exact same shape, doing its job pretty much forever.
Right. And it doesn't really care if you skipped breakfast or forgot to drink your water that day.
No, it's completely inert. I mean, once the bone heals around it, the object itself doesn't interact with your daily lifestyle habits at all.
But today we are jumping into a deep dive that throws that whole idea of the unchanging implant completely out the window.
It really does.
We've got this fascinating stack of sources for you today. We're looking at clinical pilot studies from JSM Sexual Medicine, aesthetic clinic guidelines, and these really dense material science papers on the rheology of hydrogels.
Which sounds heavy, but it's incredibly relevant.
Oh, it's fascinating. We are exploring the intersection of intimate wellness and advanced biochemical engineering, specifically G-spot augmentation using hyaluronic acid fillers.
Or HA fillers, as they're usually called.
Right, HA. And our mission today is to uncover this wild dynamic we found in the sources. We want to look at how your own internal environment, specifically your systemic dehydration levels and your metabolic shifts, literally dictate the survival and volume of these intimate fillers.
It is the absolute definition of a biological two-way street. These fillers are constantly reacting to what's happening inside you.
Yeah. And to kind of visualize this, I was thinking it helps to picture your body as this highly critical, maybe slightly stingy landlord.
I like that analogy.
Right. Because you can't just move a foreign hydrogel into the tissue and expect it to live rent-free.
Definitely not.
The filler has to constantly negotiate with the body's water supply and its metabolic rate just to avoid being evicted.
And to see why that negotiation is so intense, we first have to look at what this filler actually is, right? And what it's trying to achieve mechanically.
Okay, lay it out for us.
Clinically, the procedure is referred to as G-spot amplification, or GSA. Yeah. The whole objective is a localized physical correction of the anterior vaginal wall. So a clinician injects a biocompatible filler into a very specific, highly vascularized area.
To increase the tissue prominence there.
Exactly, to increase prominence and sensitivity in the clitorethrovaginal complex.
And the pilot study we looked at actually put this to the test by comparing two completely different approaches, which was super interesting.
Yeah, the JSM Sexual Medicine study.
Right. They took a group of 16 sexually active women seeking improvement in sexual satisfaction, and they split them down the middle.
Right, so half the group got an injection of autologous platelet-rich plasma.
That's the PRP, right?
Yes, PRP.
Yeah.
And the other half received cross-linked hyaluronic acid, the HA.
And the choice of those two highlights completely different strategies, right? Because for the PRP group, they literally draw your own blood and spin it in a centrifuge.
Exactly, to isolate the platelets. So when they inject that back in, the goal is long-term cellular regeneration.
It's biological signaling.
Yeah, the PRP releases growth factors that stimulate new blood vessels and collagen over time.
But, and this is the key distinction, it's not actively taking up space like a filler.
No, not at all. The actual volume of the PRP fluid dissipates really quickly. The HA group, on the other hand, got about 2.5 milliliters of cross-linked HA gel injected directly into the submucosal layer.
Which is, what, about 2.5 centimeters posterior to the mid-urethra?
Roughly, yeah. And the strategy there isn't just signaling, it's immediate physical volumization.
You are actively changing the topography of the tissue.
Right, to increase friction and contact during intimacy.
So the researchers track this using the Female Sexual Function Index, a validated questionnaire for things like desire, arousal, lubrication, orgasm.
And the 3-month results were pretty staggering.
They really were. I mean, both groups improved, but the POP group saw a 45.7% mean improvement, which, is great for regenerative treatment.
It is. But the HA group,
a 68.1% mean improvement.
massive difference.
Huge spikes specifically in arousal and orgasm domains. So HA was clearly the winner for immediate enhancement.
It was. And the reason it outperformed the regenerative approach so fast comes down to the actual molecular properties of HA.
Because it's a naturally occurring molecule, right? Like we already have it in our skin and eyes.
Exactly. And its main biological function is to retain moisture.
And the numbers on how much moisture it can retain are just crazy.
Yeah, a single molecule of HA can hold up to 1,000 times its weight in water.
1,000 times. That is wild.
Which is why the clinical literature calls this hydrophilic volumization.
Okay, wait, let me make sure I'm visualizing this hydrophilic process correctly.
Sure.
If I go in and get 2.5 milliliters of this HA gel injected, is the gel itself what's creating that whole physical bump in the tissue?
Oh, no.
Or is it acting more like a microscopic, incredibly thirsty sponge?
The sponge analogy is spot on. The physical mass of the gel is only a fraction of the final volume it achieves.
Oh, really?
Yeah, once it settles into the tissue, the HA polymer chains spread out and just start pulling in surrounding water molecules.
Like a magnet.
Exactly, trapping them within its matrix. It's the water it holds onto that actually creates that soft, natural prominence.
Okay, which brings us to the core of this deep dive. Because if the filler's whole reason for being mechanically successful is to act like a water-trapping sponge,
then systemic hydration is no longer just a health tip.
right, it becomes a mandatory structural requirement for the implant to even work.
It completely flips how we look at cosmetic injectables. They aren't static pins.
Because they bind water so tightly.
Right. Their performance, their size, their texture, it will all fluctuate entirely based on how hydrated you are.
So let's follow that logic. A ton of people walk around chronically dehydrated, right?
Unfortunately, yeah.
So if someone gets this intimate filler and they aren't drinking enough water, is that little HA sponge actively competing with their vital organs for moisture?
Yes, and it is losing that battle rapidly. See, the body operates on osmotic pressure, and it has a very strict hierarchy of survival.
A non-negotiable hierarchy.
Exactly. When you're systemically dehydrated, your overall blood volume drops.
Okay.
So the osmotic pressure in your tissues shifts to compensate. Your brain, your heart, your kidneys, they send out emergency signals for fluid.
Ooh, back up just a second. Osmotic pressure. Are we talking about how water moves through cell membranes to balance out salt concentrations?
Yeah, in essence, water always moves from an area of high concentration to low concentration to create equilibrium.
Okay, that makes sense.
So when your organs are starved for water, your bloodstream gets more concentrated with solutes. To fix that, the body ruthlessly pulls moisture out of your peripheral tissues.
Like your skin, your mucous membranes.
Exactly. It pulls it out of there and pushes it back into the bloodstream to keep your heart pumping.
Which means a cosmetic hydrogel sitting in the vaginal wall is at the absolute bottom of your body's priority list.
The very bottom.
The landlord is prioritizing the structural integrity of the building over the new tenant's waterbed.
That's exactly it. The osmotic pressure gradient literally siphons water right out of the HA matrix.
And without the water, the hydrophilic volumization is totally sabotaged.
Right. The filler loses its turgor pressure, it deflates, loses plumpness, and loses the mechanical ability to provide that friction and sensitivity.
I mean, you could spend a lot of time and money on this procedure and totally undermine it just by drinking too much coffee and forgetting your water bottle.
Easily. And the clinical guidelines actually take this incredibly seriously. High water intake is a mandatory post-treatment protocol.
But here is the detail from the sources that just blew my mind. Some patients are going as far as pairing these intimate fillers with regular IV hydration therapy.
Yeah, and scientifically, it's a highly effective strategy.
Wait, people are voluntarily hooking themselves up to IV drips just to keep a cosmetic vaginal filler plump?
They are.
That seems like an incredibly high maintenance commitment.
It is extreme, sure, but mechanically, IV therapy delivers fluids and electrolytes straight into the bloodstream.
Bypassing the digestive system entirely.
Exactly.
But how does the water get from the vein in your arm down to the submucosal tissue where the filler is?
It just reverses that osmotic pressure dynamic we just talked about.
Oh, I see.
Yeah, by flooding the bloodstream, you dilute the solutes. The body isn't in an emergency anymore.
So the gradient shifts outward.
Right, pushing fluid back into the peripheral tissues.
Mm.
And the HA filler, acting as that thirsty sponge, absorbs that newly available moisture.
So they're essentially watering the filler from the inside out.
To maintain its maximum structural footprint, yeah.
Okay, so let's assume someone is super diligent. They're drinking a gallon of water a day, maybe getting IV drips. Does that guarantee the filler stays perfectly intact?
No, because hydration only maintains the volume of the HA that is currently surviving.
Ah, because withholding water is only one way the body attacks this thing, right?
Right. Your body is also actively running a metabolic furnace trying to digest the gel.
Yeah, the survival timeline is a massive variable. The data says the GSA effects usually last 3 to 6 months.
Maybe up to a year for highly cross-linked formulas.
But those are just averages, right? Because a person's individual metabolic rate changes everything.
Huge role.
So if you're an athlete or you just have a naturally fast metabolism where you churn through energy, you're going to break down this hydrogel way faster.
Because your body just treats the hyaluronic acid as a biodegradable material that needs to be cleared out.
And the demolition crew for this is an enzyme called hyaluronidase.
Yes.
I've been picturing hyaluronidase as like a biological Pac-Man that just patrols your mucous membranes looking for HA to eat.
That's essentially its biological function. At a chemical level, it cleaves the glycosidic bonds of the HA polymer chains.
Hold on, cleaves the glycosidic bond so it just snips the chemical links and the structure falls apart?
Basically, yeah. The HA is this long, repetitive chain of sugar molecules. The hyaluronidase acts like molecular scissors,
Just snipping away.
snipping the links. So the massive HA sponge gets broken down into smaller and smaller fragments.
Until they're tiny enough to dissolve into the fluid.
Right, where they get swept away by the lymphatic system and excreted.
So the punishment for being in great shape and having a fast metabolism is watching your expensive intimacy filler get chopped up and carried away.
It's an inherent trade-off. But it's not just your baseline metabolism. Lifestyle factors drastically accelerate this enzymatic breakdown.
Yeah, the research points out that heat-intensive environments like regular sauna use, steam rooms, hot yoga significantly impact how long the filler survives.
Because heat increases your heart rate and local blood flow.
It ramps up the metabolic activity right there in the tissues.
Exactly. More blood flow brings more enzymes to the area, and the heat actually increases the catalytic activity of the hyaluronidase.
So sitting in a steam room is basically giving the Pac-Man a power pellet.
That's a great way to put it. It just speeds up the demolition crew.
And it doesn't stop at heat, right? The sources said hyaluronidase activity actively increases from UV exposure, the aging process.
And systemic inflammation, which is a big one.
Okay, so if the human body is this hot, metabolically active, enzyme-filled environment relentlessly trying to destroy this filler, how does it ever survive for 6 months?
Well, if clinicians injected raw native HA, it wouldn't. Your enzymes would dissolve it in hours, maybe a couple of days.
So how do they fix that?
Bioengineers physically alter the gel through a process called cross-linking.
Oh, right, the material science papers. They kept mentioning IPN-like technology.
Interpenetrating polymer network technology. Think of raw HA as a pile of loose, individual strings of yarn.
Easy for the enzymes to swallow.
Exactly. Cross-linking uses chemical binding agents to tie those strings together into a dense 3D web.
IPN technology specifically intertwines two separate networks into each other, right?
Yeah.
So it turns loose yarn into a tightly woven, heavy-duty fishing net. The enzyme can't just gulp it down.
Right. It has to slowly, painstakingly nibble away at the outer edges of the net. That density extends the lifespan from days to months.
But this cross-linking is a delicate balance, which brings us to the rheology stuff.
The physics of how gels flow and deform under stress.
Right. They track elasticity, which is G prime, and viscosity, which is G double prime.
Elasticity is how well the gel holds its firm shape and bounces back.
And viscosity is how well it flows, like a thick liquid.
And the ratio between those two determines everything about how it behaves inside the body.
Which brought up a pretty obvious question for me when I was reading this.
Oh, yeah.
If the goal is to stop the enzymes from breaking the net, why not just cross-link it to the extreme, make the elasticity huge, turn it into a rock-hard shield?
Because if you look at the anatomy of the anterior vaginal wall, a highly rigid filler would be a disaster.
Right.
Oh, absolutely. It's a highly dynamic environment, constant mechanical stress, compression, stretching.
So if it's too stiff?
If it lacks viscosity, it loses its mechanical compliance. It can't adapt to the tissue movement.
It would feel like having a hard marble trapped under the skin.
Exactly. Incredibly uncomfortable, unnatural. But also, extreme rigidity causes failures during the injection procedure itself.
Oh, because they measure the required injection force.
Right. When a gel is overly cross-linked, the force to push it through a fine needle becomes unstable. The term they use is serrated.
Serrated, like a jagged edge on a knife.
Like a jagged edge on a graph. The clinician pushes, the gel resists, the pressure builds, and then it suddenly bursts forward.
Oh, I see. A jagged stop-and-go injection.
Which means you can't place it accurately. You'd get uneven lumps and cause unnecessary trauma.
So they have to compromise. Formulate a gel with enough elasticity to resist enzymes and hold its shape.
But enough viscosity to flow smoothly and move naturally with your body.
If they can't make it bulletproof with stiffness, how do they protect it in those first few days?
Chemical armor. specifically adding mannitol directly into the HA hydrogel formula.
Mannitol. I know that as the artificial sweetener in sugar-free gum. Why put that in a vaginal filler?
Here, it acts as a highly potent antioxidant.
Okay, how does that help?
Well, the submucosal tissue is highly vascularized.
Yeah.
Just piercing it with a needle and forcing gel into the space causes microscopic trauma.
And the body responds to trauma with localized inflammation.
And inflammation triggers the release of free radicals.
Right. Free radicals are those highly unstable molecules missing an electron.
Exactly.
Yep.
So they aggressively attack surrounding structures, including the new HA chains, to steal that electron.
Let me translate this back to the landlord analogy. The act of moving in enrages the landlord, so he sends in a demolition crew of free radicals to smash the place up before the filler even unpacks.
A very aggressive demolition crew, yeah. In the first few hours, those free radicals will rapidly degrade the cross-linked net.
So the mannitol.
The mannitol is the built-in security guard. It easily donates electrons. It acts like a chemical sponge, sweeping up the free radicals.
It willingly takes the hit from the demolition crew.
Sacrifices itself, yeah.
Yeah.
The free radicals attack the mannitol instead of the HA, protecting the structural integrity during that volatile window.
Wow. So pulling all these threads together, G-spot amplification isn't just a straightforward aesthetic choice. It's the initiation of this microscopic tug-of-war.
You're putting a highly engineered, water-dependent matrix into a very volatile environment.
Right. On one side, you've got the polymer networks and the mannitol shield trying to hold their ground.
And on the other, your osmotic pressure, your metabolic heat, and a constant patrol of enzymes trying to dismantle it.
And for you listening, I think the biggest takeaway here, whether you're considering this treatment or just fascinated by biology, is how interconnected your external choices are with your internal architecture.
Absolutely.
Your daily habits, drinking water, hitting the sauna, your baseline metabolic health, they literally dictate the cellular environment inside you.
You are the architect of that environment. The hydrogel is just a guest. Your biology dictates the rules of the house.
It really makes you evaluate your hydration habits in a completely new light.
Definitely.
But before we wrap up, I want to leave you with one final thought to mull over. It's based on a really subtle detail hidden in these sources.
Oh, the inflammation connection.
Yes. So the clinical data noted that hyaluronidase, that Pac-Man enzyme, naturally speaks in the presence of inflammation. We talked about local inflammation from the needle.
Right.
But what about systemic inflammation?
That opens up a whole new level of biological vulnerability.
Think about it. Could a completely unrelated inflammatory event, say you catch a bad strain of the flu, or deal with an autoimmune flare-up, or even go through intense emotional stress, could that systemic inflammation secretly activate a massive surge of hyaluronidase?
Highly probable.
And could that immune response end up prematurely dissolving your localized cosmetic fillers, causing them to vanish months earlier than expected?
It's a fascinating hypothesis.
It's just a wild reminder of how deeply connected every single system in your body truly is. The landlord is always watching and the rent is always due.